All they have to do is ask the nursing staff or the exercise physiologist, who is on staff as well. And what will happen then is the exercise physiologist will have a brief discussion about your medical history and what you may like to achieve by doing some exercise. So we'll establish some goals. It would be good for the nurses and the EPs to be able to track your progress during your exercise. So we may ask you to do a few simple fitness tests at the completion, or at the start and also during your exercise. Exercise during dialysis is good to promote and improve the waste clearance during dialysis, and also to enhance exercise compliance. It also prevents boredom as well during dialysis because it makes the time go quicker. Some muscle soreness after exercise is common, and it can either happen the day after or even 2 days after exercising, and we call this delayed onset of muscle soreness. So what's happening there is the muscles are trying to rebuild and get stronger. So this pain, this muscle soreness shouldn't last any longer than a couple of days, and if it's a persistent pain or a sharp pain, definitely let the exercise physiology staff know and we can adjust your exercise accordingly.
They improve their functional capacity, improve their functional mobility. It can assist with walking patterns. So when they're away from dialysis, some people actually have walking aids, so it may assist with them to even get off the walking aids. It can improve or reduce your muscle atrophy or that muscle wasting. It should improve their mental health kind of aspects such as anxiety and depression. It may reduce falls risks, which in turn may reduce any fracture risks that may be associated with a fall. It can improve blood sugar management, it can improve bone mineral density, those kind of things. So all these kind of positive knock-on effects from resistance training can occur.
Well, the first thing is that over the period of your exercise, we would hope to try to progress your exercises so that you're being challenged during every session so that you're making continuous improvements. And it's also good to be mindful that if you're feeling unwell on a particular day, or you're feeling a bit flat or have muscle cramps or anything like that, that you let the exercise physiologist know, so that we can either adjust your exercises accordingly, or we may just decide to leave the exercises for that particular day until you're feeling better again.
Well, there's a few aspects to dialysing and exercising at the same time. Initially, when they have their needles inserted, sometimes they may be not as efficient as other positions or needle positions. So I guess what we look for is keeping an arm still if the fistula is in the arm, and keeping that still while you're exercising, and that'll reduce any blowout effects. Another aspect to reassuring a client would be that you always start at a low intensity, so set low weights, low resistance, or start with a nice simple or small time frame for exercising. We also monitor BP, because BP is quite a significant issue with dialysing. It often drops once they've been put on the machines, so we monitor them throughout exercising if they require it. Day to day, clients may not feel up to exercising, so we just reassure them and say, have a rest, okay, that'll reduce any risk of having an event such as blood pressure drop or anything like that. So there's plenty of sessions throughout the week, up to 3 sessions a week, so we can look at exercising at another period throughout that week, which is good.
Been dialysing for 6 years and exercising about, well, from when I started here, 35 minutes. I do 10 Ks every session. I try to keep fit, and it also takes up a bit of time while you're cycling. Yes, I took it on straight away. No second thoughts, because I normally walk for 2 or 3 Ks a day anyhow, the days that I'm not on dialysis. I think you should do it because it helps you mentally as well and keeps you fairly fit.
I've been dialysing since April of the year 2000 in Cambridge, England. I've been exercising pretty much soon after I started coming here, about a bit over 4 years ago. The exercise I've been doing are usually with Max. I do about 5 times. I do 20 pushes with each leg, and then I do 3 curl, 3 times I do 15 curl-ins with each leg. And then after that I usually pedal a cycle for about 20 kilometres. Yes, I do it pretty much every time I come for dialysis, 3 times a week, yes. Well, at first we were advised that it would help with the dialysis, and so that seemed to be a good enough reason. Also, I found that by exercising I reduced my weight considerably. I lost about, in the first 3 or 4 months, I lost about 10 kilos in weight. And it does keep my weight under control, so no matter what my diet is. Well, my initial response, because it was put in the context of this will increase the quality of your dialysis, so I thought, okay, it's worth trying. Oh, well, I just wanted to find out whether it was really true. Well, I'd say from my experience, it seems to be eminently worth trying because it has worked for me. My dialysis has been very good. My blood charts are always very good. And my weight stays down low. For a fellow of my build, that's pretty handy. No, I just encourage people to exercise because I think it does include your dialysis and it does include your general health.